Hi, it's Mr. Muhammad Javaid. I'm a consultant plastic and cosmetic surgeon practicing at Zenith Cosmetic Clinic in Nottingham. I offer labiaplasty or cosmetic genital surgery among variety of surgeries which we offer at Zenith. Today I will talk about specifically about labiaplasty. So labiaplasty is a term used mostly for people requesting labia minora reduction or inner lip reduction. Inner lip can be abnormally large in some patients, sometime on both sides, sometime on one side. So there is not only enlargement of the labia minora or inner lips, but there is a degree of asymmetry as well. It has a functional consequence as well as aesthetic consequence. Functionally, if a patient is bothered with a large size of labia, it interferes with the physical activity by rubbing against the clothes, particularly issue with wearing tight jeans, swimwear, or having physical activities such as cycling, horse riding, running. All these activities create a rubbing of the abnormally large or protruding labia with the inner side of the thighs, hence creating irritation, discomfort, in addition to having a psychological impact of patients becoming self-conscious, being reluctant to expose or being unable to participate in these activities which many patients would like to enjoy otherwise. So these are the common reasons for patients who would come and seek labiaplasty or labia reduction surgery. So the aim of this surgery is to re-establish the normal shape of the labia, and that requires trimming of the excessive tissue to regain the normal shape, where there is aesthetically a balanced portion and proportion between the outer lip and the inner lip. So aesthetically it should be just at the level or maybe slightly protruding out of the outer lips. And if this is excessive protrusion, that is due to abnormally excessive amount of tissue which requires trimming. This trimming can be done under local anesthetic in many patients. However, if patient prefers, that can be done under general anesthetic. So it's just a patient's personal choice or preference. It is done generally as a day case, requires approximately an hour and a half of operating time, and as it requires careful assessment of the excessive tissue, marking and removing that tissue, controlling the bleeding, and then doing the necessary stitching to get the shape back to normal. So aim of this surgery is to restore the normal shape. And once it is done, then patient will be given some analgesia to take home and continue with that. Will also be given some antibiotics to take orally, as well as will be given antibiotic ointment to apply on the area, which is generally covered with the simple maternity pad. Patient is generally advised to use soft clothes to prevent any rubbing in the immediate post-surgery period. I will normally follow my patients a week after the surgery. Meanwhile, they will have emergency contact number. If there is any issue or a problem, they are more than welcome to pop in before. But generally, follow-up is done a week after surgery, where I will make sure that the area is healing nicely, to rule out any sign of any undesirable, such as collection of blood or infection. But I must say most of the patients recover very well without any issue, apart from expected early bruising and swelling, which is normal. And then basically moving forward, patient is just given early post-operative care instructions for the following few weeks, which will be just gently regaining the physical activity level, wearing soft clothes, and avoiding sexual intercourse for 4 to 6 weeks. Generally, my advice will be to avoid sexual intercourse for 6 weeks, because the patient will experience some tenderness in the area and painful scarring. So one should listen to their body and make sure they are comfortable and pain-free before having a first sexual intercourse after the procedure of labiaplasty. Then I will see the patient in about 3 months' time to make sure everything has settled. I must say this is the one procedure I have found over the years with most grateful patients. So many times patients are reluctant because of the nature of the problem to talk to anyone and bringing it about, and it's a kind of suffering in silence. And once they have the procedure done, they are one of the most happy bunch of patients as they feel they can enjoy the liberty of life and all the physical activities, all those things which were source of discomfort, they enjoy in a much better way following this surgery. If you require this surgery, then contact the clinic and I will be more than happy to help you. Thank you.